Hi all, it's Leah again with Oneida Community Health at the United Health Center. Today we're going to go over the electrical activity of the heart and how it correlates with our previous session of mechanical activity of the heart and the circulation of blood. In today's session, I'll be using a green marker to identify and label the parts, the electrical components of the heart that contribute to contraction, which circulates the blood throughout the body. The first point in the electrical journey is the SA node. I'm going to use another green marker, I apologize. The SA node is a sinoatrial node and it's in the right atrium. Our second node, it's like a relay station. This initiates the heartbeat. And this, the AV node, SA node, AV node, intensifies that initial electrical signal to push that electrical signal through the ventricles, because the ventricles are the big muscle in your heart that squeezes the blood out to your body. So the SA node to the AV node, then the bundle of His, right bundle branch, left bundle branch, and these are the Purkinje fibers. They kind of wrap up around your heart so that the electrical activity is consistent to cause a nice squeezing of that muscle so the blood gets pushed equally. Again, the SA node to the AV node, the bundle of His, the left and right bundle branches, and the Purkinje fibers. I will label these as well, like I did for the components of the heart. Let's take this down now, and then I can put those labels up. So the SA node is the sinoatrial node. And this initiates or starts the heartbeat. That's here. And then we have the AV node. Which is the atrioventricular node. Which is kind of like a relay station and a booster signal for this electrical, or a booster point for the electrical signal. So we'll call that the booster station. And then the big long part here, this is the bundle of His. His is the name of the person who identified this wiring in the heart, so to say. And then the left and right bundle branches. And these little tree-like things are the Purkinje fibers. Purkinje being the person who discovered that and identified that anatomy in the heart. So how does that apply to the mechanical activity in these parts of the heart here that we talked about last session? Well, a nice coordinated electrical activity will allow the heart muscle to contract evenly to distribute the blood throughout the body. Now, many people have seen this, or a version of this. I apologize, my drawing is not the best. Well, let's make this one a little bit smaller. It's called an EKG or an ECG, and it represents the electrical, it's a visual representation of the electrical activity of the heart. So this picture represents the traveling of the electricity through the heart. This here is the SA node. This is the P wave. right here is the QRS complex. And this represents this electrical activity squeezing the heart. And this is the T wave, which is when the electrical activity of the heart resets itself to go here again. Now, the heart beats in normal sinus rhythm. They talk normal sinus rhythm because this is the SA node, P, QRS, T. P, QRS, T. So the P wave is the atria contracting. Then the atria relax at the same time the ventricles contract. That's the QRS complex. And then the T wave, the ventricles reset. P, QRS, T. In some heart conditions like AFib, this P wave is not coordinated here. It kind of quivers closed, and then QRS, and then T. If the P wave, the initial starting of the heart, is not strong and steady, the blood that gets pumped to the ventricles to squeeze out to the body is not as a smooth transition. P, QRS, T. The SA node initiates the heartbeat, sending electrical signal across the atria so the atria contract. P wave. QRS, that's the electrical activity coming around the heart here. So the ventricles squeeze, pushing the blood out the AV valves to the lungs or the body, and that's represented by QRS. The T wave occurs when the pressure in the arteries is greater than in the ventricles. These semilunar valves close, and the electrical activity in the heart resets. P, QRS, T. P, QRS, T. For people who have heart conditions, the PQRST does not always look like this, like we talked about with AFib. The electrical activity should be coordinated through the heart to have normal sinus rhythm. In AFib, this P wave is disturbed, making this EKG look a little different. So in AFib, your P wave could look like this. That is not a normal sinus rhythm, which will then change the subsequent electrical activity of the heart. For our next session, we will go more into how the P wave, normal sinus rhythm, is your heart rate, is how we measure your heart rate, and how a heart attack can change any part of this electrical activity, which then will change the mechanical or muscular activity of the heart, which can then change how the blood is circulated through the body. So I hope you understand the little simple picture or diagram that I made of the electrical activity of the heart. And we'll see you next time for how the electrical activity and the mechanical activity works together. Thank you.